So what I'd like to do is just give you a little bit of a summary of what genetics is about, especially when it comes to dealing with seizures. When we talk about genetics, we often talk about DNA, and just to remind you that DNA is this molecule that, or this sort of strand inside every single living cell in our body. And that actually, if you stretch it all the way, you can pretty much for every single cell get about 2 meters of this DNA code. And this is all wrapped inside the chromosomes. And that you probably heard about the chromosomes, and this DNA contains all these small units that we referred as these ATCG units. Now we know that there are approximately 21,000 genes within these chromosomes, and this is what pretty much codes what we are all about, whether we're heart, brain, liver, different ways of the body to function. All of these instructions are embedded into this DNA, and this DNA will eventually make proteins, and the proteins is that what's going to be important for different body functions. So obviously, if you take away, seizures that have been caused by infections, trauma, or other means, it is considered that approximately 7 to 80% of epilepsy is due to genetic factors, as has been highlighted by Dr. Wilfong. So, and in the past, I would say the past 20, 30 years, the advances in medicine and genetics have been so great that now we have been able to identify multiple genes and genetic components that we know are associated with seizures, as well as many other genetic disorders. And there are a couple of different areas that have been very important that they are highlighted in the last 2 paragraphs. One is what is called copy number variations. Basically, this is a type of situation where amounts of DNA, whether they're lesser or more DNA, can lead to different genetic disorders or deletions or duplications. And that may actually contain genes that are associated, or whose function is associated with neurological problems and epilepsy. And also, a lot of these new technologies, especially what I will refer to you in a minute as exome sequencing testing, has identified a lot of different single gene and instructions that now we know are associated with specific seizure disorders. So, why do we want to make a diagnosis? And I guess this goes for genetics, for neurology, and for pretty much every single specialty in medicine. Well, you want to give information about the particular condition. You want to know the cause, and also families want to know whether if this is something that may happen again in future pregnancies. Oftentimes, we're also dealing with genetic disorders that happen for the first time in a child, as Dr. Wilfong was saying. So, can still be genetic, but it certainly may be less likely that you will have another child with this same problem. You want to know about what is going to happen in the future with your child, whether any treatments, and what plan you can actually have, for this particular situation. So obviously, in genetics, we also deal with counseling and discuss reproductive options. Sometimes there could be things that you can do during the pregnancy to improve overall health and also help the family with coping. So that's what we do a lot in genetics. when we talk about genetic testing, we talk about looking at the chromosomes, so looking at those instructions that are within the chromosomes that may be associated with different medical problems. This is what is known as the karyotype, and you can see this is a test that we still do not as often as we did in the past, but basically you look at the chromosomes within every single cell of the body that may contain the clues as to why a particular medical problem is happening. You basically get this genetic information from the material you receive from the mother and the father. So the genetic information comes in these 46 chromosomes, and there you can see the chromosomes come in pairs, and that it is, if you have a situation where a piece of or areas of the chromosomes are altered, or the structure is modified by lack or gain of genetic material, you may end up with a number of medical problems. Nowadays, instead of doing chromosomes, we do a technique or a study called microarray study. The microarray study is basically, instead of looking at the 46 chromosomes as you're looking at here and all the small bands, now you're looking at every single piece of the chromosome, and in this particular graphic, you're looking at approximately 400,000 pieces of genetic material within those 46 chromosomes. So now we can know in really small detail if there is a small amount of genetic material that may be missing, altered, or gained in any particular individual. And why is that important? Well, we know that over the past 10, 15 years, we have identified a lot of different conditions associated with either deletions or duplications of genetic material associated with seizures. Some we have known for some time, as mentioned by Dr. Wilson, it's a condition like Angelman syndrome or 22q11 deletions, but others have been sort of more of a surprise and have allowed us to identify in the areas where those losses or gains of genetic material happen, identify some genetic instructions that have been involved and that led us to the discovery of a number of different genes. This is only a very sort of limited list of those copy number variations, either losses or gains of genetic materials, just to give you an idea. So it is a very important study that we will request in any patient that presents with seizures and other developmental disabilities. This is an example of one of those deletions. Deletions of the tip of chromosome number 1 or 1p36 deletions are associated with a condition that is typically associated with developmental delay and a number of medical problems, including seizures. These patients, 50% of them present with seizure disorder. Some actually, some of the seizures in these patients may actually do well, about half of them. The other half may actually have fairly significant intractable seizures. These patients may be difficult to diagnose, and a simple test like a microarray actually can help you identify this particular disorder. These are pictures of different patients that have these exact condition, and you will see there are some similarities among these children, and that's due to this particular chromosome problem. So in terms of doing specific DNA studies or specific gene studies, now we are doing a lot of what we know as the exome sequencing study. Obviously, when you're suspecting that a child has a genetic disorder and you suspect that there may be a mutation in a gene or genes associated with seizures or any developmental problem, you can go different ways. You can, if you're very smart clinician and that you know where your answer may be, you may ask for a single gene test, and then maybe you get your answer. Sometimes you may do something that is called a panel that allows you to look at 10, 15, 20 genes associated with a particular group of problems, whether it's seizures, heart problems, liver problems, and you may get lucky. However, now we are using more and more technology that is known as exome sequencing. Why is that? That is because in one single study, you can look at those 21,000 genes that I mentioned to you before. We know about 5,000 of those 21,000. The reality is that we are studying actually more than we currently know, and this has an advantage and a disadvantage. The advantage is that you do one study and you may interpret that study many more times in the future. Maybe you get your answer, but if you don't get your answer right away, you actually may get it later because there may be a gene that is in that particular study that was identified as a problem that we still don't know what it does. What is the exome? The exome, if you look at the whole genetic information in the body and you will imagine that as a big apple, an exome will be only a slice of that apple, and that's the part of the genome or genetic material that is best known, and is only a small part of the total genetic material in the body. So what happens is that the genes have different pieces inside, and the piece that we are looking at that has the most valuable information for us is what is called the exons. And the exons, all together, they will make this study called the exome. So what is the goal of the study? Obviously, trying to make a diagnosis in situations like these where you have a child with seizures that has a suspected genetic etiology. We like to hopefully to improve preventive care. Obviously, knowing what type of genetic mutation or genetic problem your child may have, it will be very important. As Dr. Welford was saying, if you have a channelopathy, the way you will treat this particular patient will be different than otherwise. So it's very important to have that diagnosis because that may actually guide you to do the right treatment. You also try to identify what is medically significant, and in this type of study also you may find more than just one answer. There may be you may find or not the answer for the seizures, but you may find other genetic changes that may be important or relevant to the child and even to the parents. The exome sequencing can be done in a patient and also can be done now as a trio. So you do it in the child and you do it in the parents all at once. And that has the ability to, the power that will allow us to make better calls in terms of genetic changes when we don't know whether this is just associated with a benign or a disease-causing variant. And also the whole exome is cost-effective, and even though it's a very expensive study, but when we are dealing with children that have different disabilities and we start doing studies one after the other, we can actually go through many years of work and thousands and thousands of dollars that can be avoided by just doing a single test. There are a lot of different single genes that we can identify, or mutations in single genes that we can identify with this exome sequencing. And you've already heard a bit about the the sodium channel genes. It's an example is SCN1A. The other, what is called the neuronal gating channels and associated with neurotransmitters, GABA receptor genes, and a lot of single genes that actually whose mutations are associated with seizures. Some actually may be associated with fairly significant seizures without other clinical features that may clue us as to the diagnosis, like CDKL5 or STXBP1. So a lot of different single genes have been identified over the past few years. This is an example of a single gene disorder that you may be aware of, a condition called as Rett syndrome, caused by mutations in a gene called MECP2. And this is a condition that happens in females, that they're apparently normal in the first few months of life, and about the year of age, they start developing regression, and that's typically associated with a number of clinical problems, including some unusual movements of the hands, seizures, regression in the language, problems with breathing, etc. That's just to exemplify, a single gene disorder and seizures. And as Dr. Wilson was mentioning before, one of the syndromes that we have recently identified, as associated with Dravet syndrome, is mutations in SCN1A. This is a condition that is fairly significant. It is associated with seizures, developmental problems in many cases, and in some cases could be very difficult to diagnose, as it may present with simple febrile convulsions, but then it turns into something completely different. I'm not going to go over these. This was also referring to what Dr. Wilson said about these sodium channels, which is this group of genes associated with the Dravet syndrome and also the generalized epilepsy with febrile seizures. And just to, obviously these are a couple of busy slides that I wanted to show you. This is from a review manuscript that I just looked at that has identified a number of different single genes associated with seizures and other medical problems that have been only discovered in the last 3 or 4 years, just thanks to exome sequencing study. And if I looked carefully in this particular list, I can identify actually a number of genes in patients of mine that I have been following over time that now I know that have mutations in one of these particular genes, like SYNGAP1, DNM1, and they have also, this is, I have a patient that has been found to have an STXBP1 mutation. So just imagine that these are just a list of conditions that we have learned only the last few years, and now at least we have a name, we have more information, and we can hopefully know more what to do about once more research is done. So in conclusion, we have now are able to find out more causes of genetic problems that are associated with seizures. As I said before, genetics and seizures are fairly significant, as we believe that about 70% represent genetic problems. We know that chromosome problems and issues related to copy number variations are also very common. 1 in 100 liveborn children have one of those particular problems. So the microarray is a technology that should be the first line for the study of these particular patients, followed by whole exome sequencing when we don't have a particular answer. And currently, if we take children that have been studied by metabolic studies, chromosomes, etc., and have not had an answer, with the exome sequencing, we can find 28 to 30% answers in those cases. And if you do the trio, if you do child and parents, the percentage is slightly higher. It's probably 30% and over. And lastly, thanks to these microarray studies and the exome sequencing studies, getting to know these genes, now we can target particular treatments. And there are a lot of orphan drugs out there that are being now used to approach different ways to treat some of these rare disorders. And this is something that is quite exciting, that has only been happening in the past 5 to 10 years. And there's a lot of interest about rare disorders, and that is thanks to a number of initiatives that have been put forward by the U.S. government. So this is something that is exploding, and this is something that hopefully is going to keep benefiting, all the children and the patients that we treat at the hospital. So back to the patient, what we want to know. Well, again, we want to know an answer. We want to have an idea about recurrence risk. And also having a diagnosis allows you to start networking with other parents, organizations, and support groups. It helps us to guide our patients and then get all the proper studies and evaluations that are required. And again, it puts a lot of now into the future and therapies and research that are advancing very rapidly. I think I'm going to stop here. Thank you very much for your time, and I will let the last speaker